Good morning, everybody. My name is Gaslain. I am the CEO, founder of Procare Health. I'm a biochemist by education, and I've been working on the development of popular care from the very, very beginning. And it's my pleasure today to be with you at this occasion of the Eurogin Congress. And I'd like to thank very much Joseph Monsonego for the organization and for accepting our presentation. Today, what we'd like to do is to keep on sharing with you the evidence behind, the clinical evidence behind the efficacy of papillocare, of the curl-versicolor-based vaginal gel. And what we're going to share with you today is a review of different studies that have been conducted among HR HPV patients. And the objective of this today is to share with you the consistency of the results. Next slide. Well, you may know that before we start digging into the results of papillocare, all of you are very familiar with this kind of data that we can see in the clinical practice. Here we have an interesting study that has been presented by Bulkmans in the BGC in 2007, where we can see that the, I would say, natural persistency or clearance of the HR HPV is quite important, right? So you see that at 6 months, only 29% of patients have cleared the HR HPV virus in general, and at 18 months, 41% have cleared. When we look at the specific HPV-16, obviously we are very much familiar with the fact that the H16 is having or showing a longer persistency. And we see that the kind of data that we have here is around 20% at 18 months show the clearance of their HPV. So obviously the matter of the persistency of the HPV in the vaginal area on the cervix is quite an issue here. And what we'd like to do is to share with you the results now. Next slide, please. The results of our plan of clinical development plan that we have set from the very beginning. We started with obviously a phase 1 study, phase 2A, phase 2B. We are now going into phase 3 studies, double-blind versus placebo study, and real life study as well. That is our plan of development for papillocare in these different phases. And we're going to share with you some of the results of the Paloma clinical trial and the PapilLabs today. And at the same time, it's important for you to know that we had seen many hospitals in the world, mainly obviously in Europe when the product was available, that started on their own, on an independent manner, started on their own clinical studies. No? And what we're going to do today is to share with you the results on different kind of patients. All of them have HR HPV, right? So next slide, please. So as I mentioned before, we're going to compare the different kind of studies that have been conducted in Spain in 3 different hospitals, public hospitals, and 2 hospitals in Italy, together with the results that we obtained from the clinical trial, the Paloma trial, which have been just published recently in the Journal of Lower Genital Tract Disease, and the PapilLabs study, which is an observational multicenter prospective 1-cohort study, which is looking to what we usually call a real life study. Okay, next slide, please. So when we look to the results of the Paloma clinical trial, we have 2 kind of criteria. The first criteria, the first objective of the study was a normalization of the ascus LC lesions in HR HPV patients, all of them with a concordant colposcopy at 6 months. And we have here seen at 6 months the efficacy of the curl-versicolor-based gel, where we have seen 88% of normalization of the lesion versus 56% in the control group, which was a wait and see control group. When we look at HR HPV clearance, after 6 months, we have seen similar kind of results with 63% at 6 months versus 40% in the control group. Next slide. So these results are fully available and published into the, as I mentioned before, into the Journal of Lower Genital Tract Disease, and obviously are available for your consultation. Next slide, please. Now, when we look at the other, as I mentioned before, PAPILLOB study, which is the real life study that we conducted among 188 patients, which is now concluded, still under analysis, we have looked some months ago to interim results now, and we opened the base and look at these 155 patients that was in the base, and we looked at the normalization on one hand of the cytology with the concordant colposcopy at 6 months, and we showed that there was a clear effect from the chorioversicular base gel among the normalizations. When we look at the clearance on the HPV, we have seen here at 6 months an interesting as well clearance of the HPV, where we have a significant difference between the baseline versus the 6 months. Next slide. So as I mentioned before, because of the interest of this new, I would say, therapy, some hospitals, public hospitals, have conducted on their own, in a very independent manner, some prospective study, real life study as well, to show the efficacy of the Papillocare vaginal gel. And we have different kind of cohort here in different kind of hospitals, in different kind of territories, Spain and Italy. And we are going to share with you the results of the HPV clearance evaluation at 6 months. Next slide. Well, looking at these numbers, so as I mentioned before, in the clinical trial, Papillocare Paloma clinical trial, we've seen a 63% clearance of the HPV HR in the treatment group versus the control group. We have a 59% in the PAPILLOB study of clearance at 6 months again. And when we look at the other results in the different clinical trials that we mentioned before, we have a very consistent results between 50 and 70% of HR HPV clearance. And now in 7 studies, which together makes like around 800 patients. Obviously, when we look at the efficacy, it's very critical for us to assess as well the safety and the tolerability of the gel. Well, in the clinical trial, the Paloma clinical trial, the PAPILLOB real life trial, in the most of the trials that have been conducted in the different hospital, we have seen a very good safety and tolerability. But at the same time, when we looked at other criteria of evaluation of the effect of Papillocare in the cervix itself, we've seen that there was a high capacity of the gel to demonstrate a higher reepithelialization of the cervix when it was depithelialized at baseline. But as well, we measured the evolution of the stress among the patients, and we've seen that there was a clear difference between the treated group Papillocare versus the control group, and a very good improvement in the stress evaluation among the patients. So, all in all, we have a treatment which is efficient among normalization of the lesions, among the clearance of the HR HPV, but at the same time, we've seen that this product is showing a very good safety profile, and as well, very important nowadays, considering the patients, it offers to the patients a relief in its stress. Next slide. These conclusions are obviously very much available again in the publication that I mentioned before. Next slide. And that's it. I hope you enjoyed this presentation. I remain myself very much available for any questions But at the same time, every doctors, clinicians that is interested in conducted clinical trials in his hospital, is in his territory, well, would be very much available and very much happy to help doing so. Without further ado, I wish you an excellent day and an excellent Eurogin Congress. Thank you very much. Bye-bye.